Think of depression as a physical illness. If you fracture your finger or have the flu, you're going to make an appointment to see a doctor and then get treatment. Unfortunately, when people feel anxious or depressed, they don't make an appointment with someone that can help them. According to the associate editor of the World Psychology website, Therese Borchard, said 44% of college students report experiencing feelings of depression. Unfortunately, I've had my share of friends with depression over the years, and I've even lost a couple to suicide. Depression is a very serious mental illness and can be treated with the right steps. Today I'm going to define depression, what causes it, how it's diagnosed, different kinds of treatment, and how you can help. The definition of depression, according to the Mayo Clinic, is a medical illness that causes a persistent feeling of sadness and loss of interest. Some symptoms of depression are feelings of sadness or hopelessness, easily irritated, loss of interest, reduced sex drive, excessive sleeping or insomnia, changes in appetite, restlessness, fatigue, feelings of worthlessness, trouble concentrating or making decisions, physical pain, or random crying spells. The diagnosis of depression is when these symptoms are persistent for at least 2 weeks and can last for months or even years if untreated. There can be many causes for depression, such as unfamiliar situations, like a loss of social support system, or disorders of the brain. In a study done by the National Institute of Mental Health, MRIs with brains of depressed people look different than brains with people without depression. There are a few different things you can do during the diagnosis process. Visit your doctor so you can rule out any physiological issues that may be going on. He can diagnose you on the spot, and if it's severe, for example after a death in the family, the doctor can prescribe an antidepressant medication, such as this. The doctor may also refer you to a mental health specialist who deals with the more emotional side of depression, such as therapy. After the diagnosis, you have many different options that can help with depression. Therapy is a great way to help with depression because talking about what's going on can help you discover a cause or help work you through your emotions. Family and friends are sometimes hard to talk to because they know you and may be biased or judgmental. Therapists don't know you, are unbiased, and non-judgmental, which can be less stressful for someone with depression. Another option is antidepressants. They don't cure depression, but help with the symptoms. Antidepressants relieve symptoms of depression by affecting neurotransmitters in the brain called serotonin, norepinephrine, and dopamine. Exercise is also a great way to help depression. Again, it's not a cure, but it can help with the symptoms. When exercising, you release endorphins, which also interact with neurotransmitters in the brain. Endorphins release a positive feeling and also help relieve pain. Now that you're aware of different kinds of treatments, we can talk about how you can help others with depression. Express concern to the individual that you may think is depressed and encourage them to see a doctor or therapist. If they begin therapy, encourage them to go for at least 6 to 8 weeks. Therapy is not an instant cure, and depression takes time to heal, just like a broken bone. After interviewing Tierney McNabb, she stated, "It felt like no one cared, like I was alone all the time, even if I was in a room full of people." Making sure that someone with depression has someone that is there for them is very crucial. Getting involved in a suicide prevention organization, such as the National Suicide Prevention Lifeline or the American Foundation for Suicide Prevention, you may help save someone's life. The statistics for Center of Disease Control and Prevention states that suicide is the 10th leading cause of death in the United States. Depression is a very serious mental illness, but can be treated with the right steps that I shared with you today. Today I talked about how to define depression, what causes it, how it's diagnosed, different kinds of treatment, and how you can help. There's a lot more information I could share with you today, and I encourage you to do your own research. You have the ability to make a difference in someone's life.